Good morning, Dr. Sri Ram Chandra.
Uh, Good morning, ma'am. Thank you for having me on your podcast.
Thank you for giving time. Born and brought up in Hyderabad, and I've moved to USA for several decades. Every time I come back at least twice a year. It doesn't cease to amaze me. Every city I go, particularly Hyderabad, since I've seen it from my childhood, and you go to certain parts like what they call Cyberabad or high tech city, it's like a different world. I mean, you see all young people and huge buildings, all the names that we hear about in US and worldwide. And I know that it has given employment to a lot of young people from all over the country. But I'm sure, as you read about it, there are difficulties with that occupation as well. So let's call this travails of the techie. So, can you elaborate on that?
Yeah. First of all, as you pointed out, Hyderabad has changed significantly. There was a time when it was known as the city of the biryani and the sherwani,
Yeah,
but now it has moved quite a long way. And some of the symbol of Hyderabad now is of the computer screen, the metro, all the so-called uh, high-tech problems. Um, I think about there was a study sometime back, and they estimate there are almost like 10 lakh or close to 1 million people, 1 or 1.1 million people
wow.
employed
In,
in the IT or IT enabled
I
services
see.
in Hyderabad. And this is apart from people like accountants or people in banking whose nature of work has changed, who are now again also spending hours and looking at only at a screen. So uh, there are large number of people who make a daily living out of looking at a computer screen. And as healthcare professionals, what we are seeing is the downside of that kind of a lifestyle, where they are sedentary for a long time, they are immobile, and their bodies are being held in one position, and your eyes are focused at a fixed focal length. And because this continues over a long period of time, we see that they have a lot of problems, health issues.
Even in as physicians, we are spending a lot of time like charting, writing notes, what we call in US a pajama time. You think you're home from work, but you're still doing, charting. It's about 2 hours extra after we come home. In addition to what we do at work. So even for us, everybody is getting exposed. I'm sure the students, the teachers, everybody has it. But like you said, this group, their only job is to look at the screen and
Correct.
play with the mouse and whatever they do. So the exposure is a lot more and immobility is a lot more. So can you tell us what are the problems you are seeing in in
Okay.
these people?
So here so I have seen people from this field who have problems right from head to toe, literally.
Hmm.
So when you start with first of all, there is something called the dry eye syndrome, where because people are constantly staring at a screen for a prolonged period of time, that they end up that their eyes, and of course they are not blinking because they're staying focused on some work, so they don't blink often, and their eyes become dry and they start burning. Add to it the fact that many of them are in an air conditioned atmosphere without too much of fresh air moving, so they end up having a lot of discomfort for the eye, and many of them come with red eyes. Now, the answer to this again has been provided, I think, by the American Ophthalmology Association, where they said that it's something called the 20-20-20 rule. That is, for every 20 minutes, you have to, for 20 seconds, look at something which is 20 feet away.
Ah,
Because you don't have to focus at the same focal length at any given moment in time. See, underlying all of this assumption is the fact that the human body has evolved over the years for constant movement. And in fact, we are all biologically, we are all hunter gatherers. And our bodies have been made for movement, for bending down, picking up stuff, going there, scanning the environment, looking close, looking far. So even the focal length of the eye is changing constantly. Even your eyeball also is moving constantly. But if you hold a fixed focal length and if you're not moving somewhere, even the extraocular muscles also get fatigued because they
Yeah.
hold the same
They're not
position.
moving.
Yeah, your muscles of your of which control your ciliary muscles of your eye, which control your focal length of the lens, even they also get fatigued because they're holding the same position. So that is the first thing. And the other thing, and then I've got a model here of the skeleton. And if we see here, people, you can have problems. This is the neck. So this is a model of the
This
skeleton.
is the base of the skull,
This is
right?
the base of the skull. Skull sits here. So this is the neck. This is the back, or what we say the dorsal spine, and this is what we say the lumbar spine.
This is the low back.
This is the low back.
This is
And
the pelvis.
this is the pelvis. And this part here is something called the ischial tuberosity. Now, all of us have to sit on this point. I'll explain the relevance later. So one of the commonest thing that we see is what we say is the neck problems. And this is so rampant, where it's because people are constantly, there's a chronic forward positioning of the head, where the head is like that and you're looking at it. And the muscles, the trapezius and the other suboccipital muscles are stretched. They are working constantly at an awkward biological position, and that leads to chronic pain, and that chronic pain radiates down the hands and the shoulder.
So the trapezius is the back muscles, right?
Yes, the trapezius is the muscle at the back. It's a very strong, it's a big and broad muscle which supports, which goes from the base of your skull.
It's like this.
Yeah, it is like the trapezius that we learn in geometry. So from the base of the skull, it goes laterally to the sides up to the scapula or shoulder blades, and down it
Comes
goes.
down.
Yeah, it goes all the way down the back. So it's a very strong muscle, but the upper part of the trapezius muscle actually provides support to the neck. And when that muscle is at an awkward stretch for prolonged periods of time, then it starts fatiguing and you start getting chronic pain.
So it can't support the neck as well, I
Correct.
guess.
That is one. Then the other problem that
Is there also, other than holding the position, the eye level also is important, right? Where you have the screen.
correct. That's very important. So to all my patients who come with this kind of a problem, I give them a couple of simple suggestions. Everybody likes medications, but sometimes small suggestions help. First of all, to get away with looking, if we have to work for prolonged periods of time on by looking at a computer screen, we should not work out of a laptop, because working out of a laptop for a long period of time is bad for your neck. So I suggest in that case they actually put a screen, uh, have an accessory screen which they can hook it up to the laptop, which is at your eye level or preferably just above your eye line, so that your neck is straight. That is one point.
I mean, we also have, if you're working on the laptop, there are some things that you can order, which is like a platform. It sits up and still you can,
Correct.
yeah.
So yeah, so you can do that, or what you can do is you can keep your laptop screen high, or get an accessory mouse or a
Just to type.
keyboard to afford to type. So
That's a very good suggestion. I know that I was having that problem. And once I bought that, it's much, much better. I can't tell you how much difference it made.
then the other things that I usually suggest is that people put a small alarm on their phone, and every 15 minutes you get up and then generally stretch your neck, move your shoulder blades. Even that can provide a lot of relief. And of course, the third thing is you have to find time at the end of the day to do some exercise. Right. So
Dr. Sri Ram, I know that we were talking about the back and everything. I'm sure there's a lot of work from home, so people are not using the same position, and maybe they have the video off and they relax and try to do work. So, what are the problems that of the posture
okay.
that you see?
Yeah. So that is a very valid point. Uh, in this model of the skeleton, the biological way for all of us to sit is actually take the weight on this part of the bone. Now, this is called the ischial tuberosity. Now, ischial sitting, as we sit when we sit straight, is the most natural way. But when we see that when people are working from home, they choose to sit in a more comfortable chair rather than an office chair. So most of the times they are on a sofa or a couch and they are leaning back and they're working.
So
Now,
they're going like this.
yeah, so they go correct. And when they do that, a couple of things happen. One, the first thing that happens is that the weight of the body gets transmitted from the ischial tuberosity.
Back to the front. Huh? No.
No, from front to the back. So it goes on to the sacrum.
Oh, I see.
So
Even
so
further back.
Yeah, it goes sacral back. So they're sitting like that. So it's called sacral sitting. And actually, the last part of the sacrum is the tailbone or the coccyx. Usually, the coccyx and the sacrum, there is a small joint which doesn't move. But when you're sitting for prolonged periods of time, that joint starts moving and they get a huge pain in the butt.
So that's a pain in the butt.
So that pain in the butt when they slouch, it can be extremely painful. And so once that pain starts coming in, it's very difficult for us to treat because there's not much of blood supply, so your medications don't reach. Sometimes we try injections, we can try a coccyx pillow, or finally we may need to operate to remove that coccyx.
So they just have to take it out because the pain would be so much.
The pain would be so much that they just cannot sit.
So this whole thing could have been avoided if they maintained a posture.
Correct. If they maintain a posture, so sitting on a proper office chair where your legs are supported on the ground.
Touching the floor.
Touching the floor. Because even if the legs are not touching the floor, then what happens is that your pelvis tilts forward.
If they're not touching the floor.
Yeah, if they're not. And when the pelvis tilts forward, there is extra load on the lumbar spine. And that's when they start getting back pain.
Backache.
So many times, just a small stool under the feet will actually help to reduce the back pain.
Actually, I must say that last time I visited, I was having some low back pain, and you suggested that. Now, as a rule, I always make sure that my feet touch the floor because I'm very short and they tend to be off the floor. But it has helped me a lot, the eye level and this one. Yeah.
So these are the other two problems. And the other thing, of course, is the fact that when anybody sits for a very long time without changing position, your low back, the vertebrae in the low back do not move very much. And when they don't move, your joints become stiff. And when they become stiff, then you get chronic back pain.
So these, we are taking computer techies as an example, but to different levels, even the students, I'm sure, have homework they're doing these days on the computer, and they're in every kind of position. They're lying down, and even during COVID, the students had all online classes.
Correct.
So I know many kids who are happily lying down, video off, and doing attending the classes.
In fact, one of my favorite photographs is my son lying on the bed with the video off and listening to his lecturer.
Yeah, that's quite common. And so we started with the neck, back, upper back because of the trapezius, lower back, the coccyx, and
when it also involved the limbs. So, so what happens is when somebody is, again, when they're holding the mouse, many times I've seen, and this is a problem which happens on the right hand much more often than the left. And first of all, the elbow is not supported properly on the armrest. So the elbow tends to float, then they tend to have extra strain on the shoulder. When something as simple as a mouse, the grip on the mouse and the contour of the mouse, if that is not properly held, they come with severe wrist pain. See, these are occupational illnesses. And
so the wrist pain is from the pressure on the ligaments, or what?
It is from the abnormal position of the mouse. The natural position of the wrist is what we say 30 degrees extension, mild extension. So if you have a mouse of this shape, that is more natural. But still, many times people tend to use a mouse pad where it's flat. And when you continue working for hours on end with a straight wrist, then they tend to get something called a carpal-tunnel syndrome, where the median nerve gets pressed near the bottom of the hand, and then they tend to have numbness and a lot of wrist pain.
Trigger finger.
Trigger finger. Trigger finger is another problem. Trigger finger happens when.
Can you tell us what it is, trigger finger? It's commonly.
Trigger finger is when, whenever, let's say, there's a small injury, which is more likely to happen when the movement is not there, then the tendon, which transmit the force from the muscles of the forearm into the fingers, the tendons get injured and they don't slide smoothly, and it can get stuck at one point. So it gets stuck like this, and then suddenly to straighten it, you just have to go back. So it goes with the trigger.
It's like that. Yeah.
So that is usually due to some small inflammation.
So they can get this type of injury as
They
well.
can get any kind of injuries. There's something called Dickowin stenosynovitis. They can get a ganglion of the wrist. See, many of these things occur in normal populations as well, but we are seeing a greater amount of these in techies who usually occur in a much more younger age group.
So is the damage so much that they'll need surgery eventually if they don't have good habits?
Correct. If long term, for example, long term posture of the neck, if that is not corrected by the muscles, then when your skeleton and your bones are held at an abnormal position for a prolonged period of time, then you start getting secondary changes in the bone, and that can compromise your pressure on the spinal cord or the nerve roots, and you may require surgery on the neck, as also surgery on the lower back and so on.
So we want to avoid all that.
We want to avoid all
because these are young professionals and they have a long life ahead of them.
Correct.
So if they follow some common sense rules,
Correct.
And they may not even know why they're getting these pains.
One of the things that my observation has been is that in the so-called old economy, where people moved out, did some work on their own, where there was a lot of physical labor, that was more a natural, more a physiological way of doing, where a human body is working the way it was designed for. The human body has not been designed to stare at a fixed focal length point, which is a few feet away, for a prolonged period of time, holding the same position for a prolonged. We are not designed for that. And that's the reason why we tend to have a lot of problems.
Yeah, I mean, who would have thought that you would get paid just to stare at something? And, otherwise people will run around and, our ancestors, millennia ago, they had to run around to get their food,
And along with this, there is one more cultural phenomenon which I've noticed, is the fact that a lot of these techies, many of them who are financially much better off than their parents or grandparents, they tend to believe that they know what is best. So they don't listen to simple advice which your forefathers give you. And the first point of reference is Googling something. So you open
Dr. Google.
So Dr. Google, actually, I'm on a lighter note, I'm very thankful to Dr. Google, because every day about 25 to 30% of my patients are people who come in who've read up something on a search engine and who are petrified because there is such an excess of information that they don't know how to screen it. So if somebody types neck pain and there is so much of information,
there's cancer to everything.
It can be anything. And then they come and they say, see, this is there, I require surgery. If I get operated, what's going to happen to my children? How's my life going to be?
So they're thinking way ahead.
I mean, it's been told that people build castles in the air, but many of them build dungeons in the air.
That is true. That's a good one. So that's thank you so much for giving all these tips, and it's fantastic.
Sure.
I think, we see all these very successful young professionals, and indeed they're really putting their body through a lot,
Yeah.
And, they're so young, and they should take care of themselves at this age.
No, and they are the future of the society.
Absolutely. I'm very proud that we have such young professionals. We're the back office of the world, and we're the brains also now with so many startup companies. But guys and girls, you please take care of yourself, because we are very proud of what you do. But listen to your body.
Yeah.
Right. Okay. Thank
Thank you.
you, Dr. Sri Ram.